Hello everybody, today we are going to learn how to give advice and suggestions or recommendations in English in a pharmacy setting. Okay, to start with, the standard way of giving advice is by using a modal verb that you know for sure, which is should or shouldn't. You can use a synonym that might not be as familiar to you. It's kind of fancier, ought to. So let's take a typical example, smoking. You might say something like, you should stop smoking. Or if you want to sound fancier, you might say, you ought to stop smoking. All right. From here, I can increase the intensity to make it sound like an obligation. I might use some expressions such as you need to or you have to. And if I want to play mom and dad, I might use an expression such as you had better, which implies that there is a negative consequence to this suggestion, to this obligation. This might look something like, you need to take it before meals, or you had better take it in the morning, and there is a negative consequence if you don't. All right, here are some softer suggestions. It might be a good idea to get more exercise. Or if you can put yourself in your patient's shoes and use a conditional statement. If I were you, I would get more sleep. Note that we use were here with I. Then you can frame it as a question. Why don't you try getting more sleep? Notice that we have ing here. With try, notice try getting more sleep. All right, let's imagine that you have to make a suggestion that is backed by evidence, something certain. For example, you might have a patient who comes to the pharmacy and they have like a bruise, and you might suggest something certain like ice. So you would say something like, ice will reduce soreness because it's certain. What else? You can use imperatives, especially when you want to influence people's behaviors. And there are some nice expressions that you can use. For example, if you want to eliminate some behavior, you might say, try to avoid driving, or cut out on salt, or give up alcohol. Or if you want to reduce some behavior, you might say cut down on fatty foods. And if you want to encourage someone, you might say carry on doing exercise. And don't forget that we use ing here. What else? What else do you need to know about giving advice? Well, let's talk about warnings and cautions. For example, if you want to alert a patient about possible side effects, you can use a modal such as might or could. This drug could interfere with your gut bacteria. And if you want to advise caution, you might say make sure you take this drug in the morning. Or for stronger suggestions, for stronger warnings, you might use beware or mind you. Beware, this drug will make you sleepy. And that's it about advice and suggestion. Thank you.